Welcome to Ask a Pharmacist Corner. My name is Marcy. This week we're going to talk about a topic that somebody asked about in the comments, to talk about acid and gas. This is a huge topic, so I'm just going to touch on the acid this week, and next week we're going to talk about gas. So the topic of acid comes from heartburn. So customer comes to the pharmacy and says, I have heartburn. I have increasing heartbeat, palpitation of the heart sometimes, and I have pain in my chest, about the esophagus area. Before anything, I'll ask them about the symptoms that they're having, and first I ask them how long they had the issue or the problem, and when was their last meal of the day and what they ate. For either dinner or lunch. The other things that I ask them to find out more about the issues or the problems they are having is if they're eating late during the day, at night, just before they go to bed, or if they had a kind of food that would cause the acid to come up. So that what happens is if you have acidic food, too much of it, or if you have food that cause the acid can come up through the esophagus through the throat, and the acid can cause coughing, or they can cause sourness, or you can feel it in your throat, and they can also cause nausea. So the questions that I ask them usually is what they eat for dinner. And if they tell me they have like fried chicken or French fries or anything that's acidic, then I say, okay, that means you probably do have the acid. And I will talk to them about what they can do to prevent that, and what medications to take over the counter. And again, the medications that I talk about is only the things that I think off of my experience works better for them. So I don't suggest all the medications that are available to them. I only tell them what's good to take and what can work for them. And if they don't get any result from it, then they have to go see a doctor. So the foods that do lead to the heartburn, I always tell them to stay away from also is tomatoes, orange juice, anything that's acidic. And orange juice is very acidic, and tomatoes are acidic. Pizza, cheese, French fries, salsa, spices. Too much coffee during the day also can cause high acid or heartburn, or even reflux. They're all the same kind of words, just different saying it. The first medication that I do recommend to them is to take, if it's just a short term and just ate last night and they're feeling sick, then I would tell them to, and it's short, very short term, and it just happened for the first time, they can use Pepcid AC. Pepcid AC is a medication that prevents and can take away the heartburn. So it reduces the heartburn or the acid by taking the heartburn away, and also prevents the heartburn from happening. But the Pepcid AC is one of the first medications that can be used if they say, oh, I just ate shrimp, or I just ate fried food and I feel heavy in my chest. That's the thing. That's the medication to use right away. And Pepcid AC comes in different doses. It comes in 10 milligram over the counter, and prescription ones are 20 milligrams. So they are given for the condition. They take about 15 minutes to 30 minutes to work, and they're very effective. There's hardly any side effect if they're used for short term, but if they are used for on long term basis, they can sometimes cause diarrhea and constipation. The other medication that I like very much, and I tell the customers to use it if they had the acid for a few days, is and they're acid reducers. As we call them, acid reducers, or in the pharmacy we call them proton pump inhibitors. That means they reduce the acidity of the stomach. And these are like Prilosec is one of the ones that I really like for short-term use of 2 weeks. And Nexium and Prilosec are also available. If the problem is not bad, I would recommend Prilosec because the Prilosec works really quickly. But if they have had it for a long period of time, then Nexium is and Prilosec are a stronger medication that can be used for to reduce the acid of the stomach. Prilosec or any of these class that are acid reducers, they can be used. Basically, how I like to tell people to use them is in the morning when they wake up, half hour to 1 hour before eating. Half hour is actually good enough, and it does do the work. And if they do forget to take it just before they eat, it works better that way, but they can actually take it any time of the day. The good thing about this medication, especially Prilosec, that I like very much for the beginners or the ones who just had the heartburn, is it's once a day dosing, and there are packages available for 14 days, so you take one a day for 14 days. If a customer say, oh, I really have a pain now and I don't want to wait, they can take it right away. It doesn't matter when during the day they take it. It does do the work, but it does work better in the morning, just after they wake up, and they can take once a day during the day for 14 days. The other thing that is actually very good to use, but they are the other medications but they are to be used with these medications, Prilosec or Nexium, in conjunction with them during the day if they need it. So if you take Prilosec in the morning and it's working really good, and then you have a heavy food, then I would tell you can use something like Maalox or Mylanta. The ones that I like are in combination with acid, antacid, and anti-gas. And the reason for that is the ones that are in combination with anti-gas, they also reduce the gas of the stomach. Acid can cause gas also. So if you take something that has antacid and anti-gas in it, both of them together is more effective than just taking something that's just for acid. So Maalox, Mylanta are one of the ones that are used a lot. They're the chewable tablets, or they come as advanced or plus Maalox Plus or Maalox Advanced. They're all very good to use. But also with these medications. So if they're just used by themselves, only for once is okay, or only as needed is okay. But if they're to be used all the time, it's not going to be, it's too much, and they can cause rebound effect. Another one that can do that is something like Tums. Tums in conjunction with Prilosec is good, but if it's used just by itself, a lot of young people eat heavy food like pizza or a lot of acid food or French fries. They start using Tums all day long because it comes in small carrying cases, and they just pop one on all the time during the day. But the bad thing is, just by taking the Tums by itself, it can cause gas in the stomach, and it actually makes the situation even worse after using it for a long time. Tums are great to use, especially if they come with acid, and their combination with acid and gas, which are new in the market, and they're really, really good. I do advise them. They're chewable and they do work. But they are to be used after heavy meals. If you feel like you have something heavy, underneath your esophagus, or you have a little bit of acid here and you get burning, then the Tums would work greatly after meal, just like Maalox and Mylanta. The one thing that I would tell my customers is try to stay away all the acidic foods during these 14 days or during the time that you don't feel good. At night, do not eat very late. Have your dinner around 6 o'clock, and after that, don't have any heavy food. Chocolates are not really good to be used just before bed, because the chocolate is very highly acidic, and it can actually cause acid come up. When you want to see, when customers or patients tell me what I do, I cannot sleep at night, I tell them to raise the head raise their head, put a pillow, a higher pillow, and so they raise their head so the acid doesn't come up to the throat to cause nausea in the morning. These are to prevent. These medications like Prilosec, Nexium, they reduce the acid in the stomach, but they also prevent, but they're only to be used for 2 weeks. So after 2 weeks, if you still have the symptoms, that means it might be a little bit more serious than just a little bit of heartburn. So you should go see a doctor, and you should get treatment, but also you're prone to acid, so you should stay away from heavy foods. Again, if you have any question, you can leave it on my comments, or email me at marcyrx@yahoo.com, marcyadl@gmail.com. So marcyadl@gmail.com or marcyrx@yahoo.com. Thank you very much and have a good day. Bye-bye.